try. We will definitely make an arrangement for you to see a medical oncologist so that they can discuss with you hormonal therapy, because that's the standard of care.
And what about radiation?
You will not need radiation because you had your simple mastectomy.
Well, that's what I understood, but okay, that's why I had a mastectomy.
So if you imagine, so there are two ways that we address breast cancer. One is systemically, because we worry about little cells that have escaped, right? We worry about cells that have gone out. Mm-hmm. But that's the whole reason why we did the sentinel lymph nodes, was because they're the ones, they're the guards, so the front runners.
Right.
If they're going to see metastasis, if metastasis is going to occur, I should say, they will be the first ones to see it.
Well, if this wasn't sectioned, avoiding, if there's still cells in the suture point.
Which we suspect there aren't, but if there are, then you'd have to go back and have it resected. And you'd have to go to surgery, you'd have to take it, you'd have to have it taken out again.
So radiation isn't a chance.
Well, the thing is that it wouldn't be the best choice, right? Yeah, in my opinion. And the reason, and there are two reasons for that. One, going to surgery, you can take out more, you can cut it out more. Radiation is also very similar to surgery. It's a very focal. And when we talk about the two approaches, as I was saying, there's the systemic, which attacks any little cells that have gone out, and then there's the focused. It's radiation and surgical are the focused modalities. Now, if you can undergo surgery, which you seem to make it through pretty well, you're a healthy young woman, so you did this, you made it through. Going through a very simple procedure to excise whatever superficial margin, if it is still positive, you know, then that would be preferable for you undergoing radiation. Because radiation, although they can focus on here, I mean, there's other structures under there. There's lungs. There's,
I don't want to have radiation.
And you don't want to have radiation because you can get pulmonary fibrosis. You can get all these kinds of skin changes, non-healing, and really at the end of the day, you know, while it's a viable choice, you know, I mean, you went through a mastectomy in the first place, right? So why not just go back?
Well, if I do have a resection, will it be this much fluid?
No, because it's a superficial margin that we're concerned about. Yes, that was the one that was the concerning one, because the other ones, there's no skin involvement. See, and so. And there was definitely, let's see where your margins here, right here. They basically talked about
this one.
Is it this one here? So
less than this is the one.
Yeah, and that's the and that's not going to get any. I mean, all your margins are wonderful; they're very clear. What we aim for is a 2 millimeter margin. 2 millimeter margin, more than 2 millimeters. That's fabulous.
Okay, so this is the stuff that's clear.
Yes,
and
absolutely.
The tumor they took out.
Absolutely.
But this one is less than 0.1 centimeter, which means, well, as you say, you can't go further, but you can go wider. That's my point.
Yes, you can. But I'm wondering if there's a need to do it, because we usually excise the skin overlying the tumor. Do you know what I'm saying? So that tissue, that tissue underneath may not be.
But there was two types of cancer. There was.
But
I know, there was DCIS and then there was some mucinous invasive.
Yes, but regardless, the margin, if usually we take the superficial margin, like I said, we'll confirm it with him, but this is why I was not as concerned, because you cannot take any further superficial. I mean, that's it.
Right.